Hi, my name is Heather. I'll be giving a mixed dose of insulin today per my EMR. I have my patient, Tony Kirkland, and I verified the orders in the EMR. I would walk into the room, perform hygiene, introduce myself. I would have my patient identify themselves with 2 patient identifiers, name and date of birth. I will explain that I'm here to give them their insulin today and explain, ask if they have any questions after I've checked their blood sugar. I gather my supplies, and then I will take these and I will double check the expiration dates, that it's the correct medication. I will check it against the MAR. Everything seems to be in order. So now I will take my NPR, and you need to roll it, not shake it. Now that it's nice and mixed, I will take my alcohol swab, and I will ensure that that the top of the vial is sterile. And then I will pop the top off of the regular insulin and do the same thing, ensuring sterility. Okay. Now that I have made sure both vials are sterile, I have, what is it here in my EMR? I have 6 doses of regular insulin and 6 units of regular insulin and 12 units of cloudy insulin. So I will open my package, making sure not to contaminate. And I've pulled out. I will take off the cap, and I will first pull out to 12, pulling air into the syringe. 11, 12. As you can see, I have 12 of air. And that will go into the MPH, not touching the solution, just enough to inject the air in. And then I will draw back, and then I will pull up to 6 of air. And I will then inject that into the regular, into the airspace. But I will not be withdrawing. I will then flip it. And then pull back to about 8, so I can make sure any air is gone out of my syringe. And then up to 6. It appears that I have no air in my syringe. I have 6 units. And now I go into my NPH, flip, and I will draw back to 18. And now I have 18 units of insulin. I would then recap my needle. I would call a second nurse to come verify my order and make sure that I have the correct amount of insulin in the syringe, since it's a high alert medication. I would label this and then give it to my patient. And I would make sure to document everything that happened.